Hello everyone. In this video, I will be sharing and highlighting a monoclonal antibody lipid-lowering therapy, PRALUENT Alirocumab, which was initially approved by the US FDA in July 2015. Alirocumab is an injectable medication for reducing low-density lipoprotein cholesterol, LDL-C, in adults and pediatric patients with hypercholesterolemia. Now, let's dive into this medication in more detail. Alirocumab, brand name PRALUENT. This medication was initially approved by the US FDA on July 24, 2015, and currently indicated to reduce the risk of major adverse cardiovascular (CV) events, coronary heart disease death, myocardial infarction, stroke, or unstable angina requiring hospitalization in adults at increased risk for this event, as an adjunct to diet and exercise, to reduce low-density lipoprotein cholesterol, LDL-C, in adults with hypercholesterolemia, adults and pediatric patients aged 8 years and older with heterozygous familial hypercholesterolemia, HeFH, adults with homozygous familial hypercholesterolemia, HoFH. Chemically, Alirocumab is an injectable human IgG1 monoclonal antibody with a molecular weight of 146 kilodalton. PRALUENT is available as 75 mg per 1 milliliter or 150 mg per 1 milliliter in a single-dose pre-filled pen. With regard to storage and handling, given Alirocumab is a protein, stored in a refrigerator at 2 to 8 Celsius, which is 36 to 46 Fahrenheit, in the original carton to protect from light. Do not freeze, do not shake. PRALUENT may be kept at room temperature up to 25 Celsius, 77 Fahrenheit, in the original carton for 30 days. If not used within the 30 days, discard PRALUENT accordingly. Depending on specific indications, recommended dosage for adult patients is 75 mg or 150 mg given as subcutaneous injection every 2 weeks or 300 mg every 4 weeks. Notably, for the 300 mg dosage, give 2 150 mg PRALUENT injections consecutively at 2 different injection sites. The recommended dosage of PRALUENT for pediatric patients with a body weight less than 50 kg, which is 110 pounds, is 150 mg once every 4 weeks, administered subcutaneously. For pediatric patients with a body weight of 50 kg or more, it's 300 mg once every 4 weeks. See prescribing information for dosing details. Mechanistically, this medication works as a PCSK9 inhibitor, preventing LDL-C receptor degradation and increasing LDL-C receptor recycling and expression, increase LDL-C uptake and therefore lower LDL-C levels in the circulation. Pharmacokinetically, Tmax, that's the median times to reach maximal serum concentrations, was 3 to 7 days following 75 to 300 mg subcutaneous dosing. The absolute bioavailability of Alirocumab was about 85% following subcutaneous administration. Further, based on intravenous administration studies, the volume of distribution of Alirocumab was about 0.04 to 0.05 liter per kilogram indicating that it's largely distributed in the circulatory system. Its median apparent half-life at steady state was 17 to 20 days. Metabolism. Alirocumab is expected to be metabolized into small peptides and amino acid via catabolic pathways. Contraindications. History of a serious hypersensitivity reaction to alirocumab or any of the excipients in PRALUENT. The most common adverse effects greater than 5% in adults with primary hypercholesterolemia, injection site reactions, and influenza. In patients with established CV disease, myalgia. Here are the key references which I have used to prepare for today's video. The US FDA New Drug Approval Updates is a very valuable resource. In addition, most of the medication information which I shared today is based on the PRALUENT prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. In addition, if you like this video, please check out my other PCSK9 inhibitor medication videos on the screen. Finally, I want to thank you all so much for watching. If you find this video helpful, please subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.